My name is Dr. Ryan Shelton. I am with mygotodoc.com. I am a functional medicine practitioner. I've been practicing functional medicine for 20 years now. So I need to explain what functional medicine is because a lot of you out there may not know the benefits, the advantages of using a doctor that's not only been trained in conventional medicine, but also in functional medicine because it has some great benefits. It has some great advantages. So, again, my name is Dr. Ryan Shelton. I've been doing this for about 20 years. I'm excited. I'm newly on board to mygoto.doc.com. And this is a new service that we're now offering nationwide. And so I encourage you to take advantage of it and make sure to tell your friends and family to do so as well. Now, what is functional medicine? Functional medicine, it really encompasses a dynamic approach to assessing, preventing, and treating complex chronic disease. It's set up to treat chronic disease. And why is that so important? Because 50% of adults in the United States have at least one chronic health condition, and 25% have at least two chronic health conditions. Chronic health diseases account for 86% of all healthcare costs. So it is very common to have chronic disease. Functional medicine is not well suited for acute issues. If you cut your finger, probably not an area of functional medicine. If you have an acute ear infection, probably not an arena for functional medicine. Although later on, once that condition is treated acutely, functional medicine can certainly come into play to help support the immune system and support the body to prevent further infection. Now, why is functional medicine important? Because chronic disease is so common. And the causes of chronic disease are only increasing, particularly in the last few years. So the root causes of chronic disease include inflammation, chronic inflammation, infection. We've all had a heavy dose of knowledge about infection from viruses and bacteria, especially since COVID has started. Environmental toxicity, trauma, stress, lack of sleep, inactivity. So, this is inactivity of the physical body, lack of exercise, inactivity of the mind, inactivity of relationships. If you're feeling isolated since the pandemic has started, and certainly deficiencies as well. Now, I want to take your questions. I want this to be an interactive process as much as possible. But today is just a general introduction to functional medicine. So let me see if I have any questions quite yet. Not quite yet. So I'll get into more of the greedy detail. What are the benefits? Why would you choose to see a functional medicine doctor? Maybe you want to see a doctor who will treat all of you, not just one symptom or maybe two symptoms, and not just your illness, but take you as a whole person. And it requires time to listen and understand genetic, environmental, and behavioral lifestyle factors that can affect your health. And look, practitioners cannot understand you as a whole person in just a 5 or 7 minute consult, which is the average amount of time that you see your primary care provider. So, at an appointment with a functional medicine doctor, you'll likely spend an hour or more talking with your physician, talking with the functional medicine doctor so that they can get a clear understanding, a comprehensive understanding of who you are. So we're treating all of you through functional medicine, not just a symptom. We're not just putting a band aid on a symptom. We're treating the whole body so it becomes a higher state of health and wellness so that some of the biochemical, physiological factors that cause chronic disease start to dissipate. Now, Maybe you choose a functional medicine doctor because you want a personalized treatment. It's not a it's not a one treatment fits all type of approach. Functional medicine doctors understand that treatment, whole comprehensive treatment, isn't the same for every individual. After your visit with a functional medicine doctor, you'll hopefully leave that appointment with a treatment plan uniquely tailored just for you and your healthcare needs, which perhaps you've never had before in the past. Maybe you choose to see a functional medicine doctor because you want to treat the root cause of the illness and not just the symptoms. Sometimes having trouble, for instance, sometimes having trouble sleeping, aches and pains, fatigue, headaches, some of the symptoms of long COVID, strange or hard to treat symptoms, indigestion, stomach discomfort, GI distress. They tend to be symptoms of underlying condition. And we'll talk about some of the pillars of those underlying conditions here in a few moments. And while symptoms can be managed through conventional care, through uh, having a symptom and trying to match that up with a pharmaceutical medication, the approach of functional medicine is more understanding the root cause of the complexity of your health issues. Maybe you want to see a functional medicine doctor because you want to actively participate in managing your own health. Maybe you've struggled seeing conventional doctors and you're tired of just being prescribed more and more drugs that are not creative, they're not individualized at all. So it's an understanding, it's a relationship that develops between the patient and the provider, and teaching you being open to learn how to get well and stay healthy. And it's rarely a quick fix. It takes some organization in terms of your lifestyle, your behaviors, and we'll get into that in a little bit. And what I like about this is patients really feel that they have an opportunity to be empowered and hopeful as they engage with their functional medicine doctor because they're actively helping to manage their symptoms. They're giving feedback to their provider is giving feedback to them. It's an integrative process. And many patients in my experience are really excited about that because they take ownership of their own health. And maybe you want to see a functional medicine doctor because you have had chronic pain, you've had chronic fatigue, you've had chronic headaches, you've had long COVID, and nothing seems to work. And you're frustrated. And that's common. And you're tired of using pharmaceutical medications or over-the-counter medications just as band-aids. And that's very common. And a functional medicine approach utilizes a comprehensive treatment protocol that's individualized where you see benefit comprehensively, and symptoms that are problematic are minimized, and symptoms that maybe have been on the back shelf that have been troublesome but they're not in the forefront, they tend to improve as well. Now, what's the approach of functional medicine? We identify and treat the root cause because it's the root cause that's causing all of the symptoms. We're not looking merely to eliminate or suppress the symptoms. We're looking to build the body up into a state of higher health and higher wellness. And certainly, a principle is first do no harm, utilizing methods and medicinal substances which minimize the risk of harmful side effects, using the least force necessary to both diagnose and treat. And avoid, when possible, using harmful suppressive medications. The next principle is doctor as teacher. That's originally where the word doctor comes from is docere. It means teacher. So one of the goals of functional medicine providers is to educate their patients and encourage self-responsibility for health, recognizing that there's always more than one option and that chronic disease is very complex. Treating the whole person. Functional medicine doctors treat the whole person, taking into account physical, mental, emotional, genetic, environmental, social, financial factors, because all of those factors play a role in your health. And since total health also includes spiritual health, functional medicine doctors encourage individuals to pursue their personal spiritual development. And then, certainly, a cornerstone of functional medicine is prevention, not only addressing the current health issues, but building up the body overall so that we prevent further issues coming up down the line. Now, the approach often involves what I like to refer to as the 5 pillars of health. So this is really lifestyle, behavioral health. The first pillar would be diet and nutrition. The second would be therapeutic movement. And I say therapeutic movement versus exercise because some people they're allergic to that word exercise. This is really about moving the body, moving the mind, moving yourself in your social circles as well. So therapeutic movement is the second pillar of health. The third would be hormones. So hormones and hormone imbalances can wreak havoc on your health. And this includes adrenal hormones, estrogen, progesterone, testosterone, neurotransmitters. So hormones are the internal messengers of the body. You can think of them as emails or texts. And if those emails or texts are not integrated, if they're not imbalanced, if they're not communicating well, then you will suffer from ill health. The fourth pillar of health would be detoxification and the mind body relationship. So, detoxification is often important because we are inundated. We've created a very toxic world for ourselves. It's very convenient, but it's very toxic. And so, environmental toxins can play a negative impact on our health. And then the mind body relationship we cannot overlook. And then finally, the fifth pillar of health would be supplementation with nutraceuticals, botanical medicine, or also prescription medications too. I'm going to cut out for just a moment. I encourage you to ask some questions. I'll be back in 1 minute. All right. I apologize for that. Let's see. I'm going to take some questions before I go on, and there have been a few questions come in. So let's see. Functional medicine for severe depression. Uh, okay. Functional medicine for severe depression. Does it make sense? Well, severe depression, it depends on the stage of depression that you're at. There can be a severe depressive disorder that tends to last about 2 weeks. It really depends upon the stage of depression that you're at, but absolutely, functional medicine can be effective for depression, for anxiety, for a number of mental health conditions. So, stabilization is the most important part to make sure that you're safe, but absolutely, functional medicine can be applied quite effectively to depression and anxiety. Let's go through some other questions here. What are natural vitamins to use for brain inflammation and anxiety, as well as neck pain? Well, there is a long list, but the premier herb, it's not a vitamin. Certainly, there are vitamins that can be helpful for brain inflammation, and we could get into that with an individual consult. But for both brain inflammation and joint inflammation, probably the premier herb that I would consider would be turmeric. And the dosage really depends upon the individual. Most of the time, turmeric is underdosed. An effective dose tends to be around 1,500 to 3,000 milligrams per day. But that's a great herb for both brain inflammation and joint inflammation. Next question, which would be better for exercise and tolerance and get issues, ivermectin or low dose naltrexone? Ivermectin would be more effective for that. Hormonal factors, that's not a question, just a comment. Let's see. Here's a comment. At 61, it feels like too late to surmount the various challenges from weight, joint injuries, lifestyle habits, hormones, all the things. And that is not true. It is never too late. I've helped individuals in their 70s, 80s. It's just a matter of the capacity to change some of the lifestyle and behavioral habits that have formed over time. Certainly, the older you are, the more entrenched those habits can be. But 61 is not at all too late to implement some changes and see some significant improvements in functional through functional medicine. The next question here is turmeric good to take as a long haul survivor? If so, powder or capsules, or does it matter? Turmeric is excellent for long haul survivors. Powder or capsule shouldn't matter too much. An issue with turmeric is bioavailability or absorption. So you want to make sure that it is a highly bioavailable form of turmeric. Uh, s- um, or it can be coupled with another agent called biopurine, which is an extract from black pepper. It helps to absorb the polyphenols within turmeric by as much as 100%. So making sure that the form of turmeric is well absorbed and that it's standardized to those important polyphenols. Again, the dose varies between one individual and the next. The effective range for most people tends to be about 1,500 to 3,000 milligrams per day. Let's see here. Lots of questions coming in. Good job, everyone. Here's another. I'm not sure I can get to all the questions, but keep them coming. I still have some more general stuff to cover about functional medicine. Let's see, I'll choose this one. I suffer from hot flashes about 1 minute after waking from sleep, even a nap. Um, Anxiety in the morning. Also deal with upper abdominal bloating, mainly after eating. All since COVID. Yes. I am 7 years past menopause. So, just reading this, this is a typical case where since COVID, you've noticed X, Y, and Z, which were never there before, and it's affecting how your body functions. It's affecting your overall physiology. Perhaps there's a permeability issue with your digestive tract. Perhaps it's an assimilation issue with your digestion. It could be a defense and repair imbalance with your immune system, with your inflammatory response. Floating through your bloodstream, there could be microclots, there could be an excited immune system, an overexcited inflammatory response. It could be energy imbalances. It could be hormonal imbalances. It could be due to a low grade or recurrent infection, a viral infection that can be going on. There could be some environmental toxicity involved as well. So, that is an excellent case where I have all of these new symptoms since COVID. How do I deal with it? I'll tell you how not to deal with it is put a band-aid on this, put a band-aid on that. We need to understand the root causes, the root imbalances. It's a it's an excellent point. I'll get to one more and then I'll get back to my stuff and then I'll circle back to some questions. Are there foods that exacerbate inflammation and should be avoided? Sure. So, sugars, refined carbohydrates should be limited, if not avoided. Uh, Fried foods or foods cooked at high temperatures can should be avoided because of the constituents of the fatty acids. If you change fatty acids in a certain way, they can contribute to inflammation, and so we want to avoid fried foods, foods cooked at high temperatures, refined carbohydrates, and basically anything in a bag, a box, a sack. So, processed foods, fast foods, certainly avoid those. You want to stick with whole foods, rich in fruits and vegetables, nuts and seeds, beans and legumes, to the best of your ability. I said I was going to do one more. I'll go ahead and hit one more here. Looking to reset fight or flight response, what are some more intense ways I can regulate this to get my cortisol levels back to normal? Yeah, great question. So oftentimes where I begin is testing those hormone levels uh, released by the adrenal glands, making sure that the circadian rhythm of those adrenal hormones are accurate as well, because you can have normal total amounts of cortisol and DHEA and epinephrine and norepinephrine. But if the circadian rhythm is off, that can negatively impact you as well. So I always start at looking at the adrenal glands. I always start with some lab tests to understand where we are. And the vagus nerve is very, very important to help balance out uh, imbalances of cortisol levels. So uh, there's the sympathetic nervous system, the parasympathetic nervous system. Cortisol in the adrenal glands mostly concerned with the sympathetic nervous system, this fight or flight response that you may be experiencing. The parasympathetic nervous system is more involved with, instead of fight or flight, the feed and breed. So it's calming the parasympathetic nervous system, and there are lots of simple things that you can do to help stimulate the vagus nerve. And some of this may sound too simple, but there have been studies on laughter, meditation, music, dancing, hugging, playing, massage, yawning. All of those, curiously, have been studied to positively affect the parasympathetic nervous system, which I think is fantastic. If you can begin to laugh more and get better sleep and dance and listen to music and it improves your health, I think that's fantastic. So I'm going to continue on with the subject matter here, and then I'll get back to some questions. An important aspect, actually, two important aspects of functional medicine. The first is that we can start to get creative about laboratory investigations. It's not just going into a lab and getting some blood drawn for a CBC and a comprehensive metabolic panel, maybe some antibodies here and there, maybe some general non-specific inflammatory markers, maybe some antigens for certain viruses, but it's pretty limited in what conventional medicine can do in terms of laboratory testing, maybe some imaging as well, x-rays, CT, MRI. Functional medicine, we can get closer into what is actually happening physiologically in your body. We can look at your immune system in more detail. We can look at inflammation in more detail. We can look at neurotransmitters and hormones in more detail. We can look at digestive health in more detail. And as a functional medicine practitioner, and many will tell you this, that health starts in the gut. If we're eating the wrong foods, we need to fix that. But then if we're not able to digest and assimilate those foods without causing inflammation, we need to fix that as well. And so functional medicine can really look at the capability of your digestive system to make sure that what you're eating isn't causing more harm than good. So I love the availability and the creativity that we can have to really individualize your diagnostic approach and your treatment approach, because we can get a clearer understanding of what's going on inside, not just the generic markers that most doctors test for. So I love that functional medicine has this available. Next, functional medicine not only involves implementing positive strategies in terms of diet and lifestyle, maybe taking some vitamins or herbs or other supplements to help promote better health, optimal health. It often also involves removing obstacles and negative coping patterns. How often does a doctor talk to you about, oh, okay, eat lower cholesterol foods, exercise, we got to get your high blood pressure under control? What about removing obstacles and negative coping patterns? Because that is immensely important to your overall health. So, this means your dependence on chemicals, legal and illicit, both legal and illicit drugs, alcohol, smoking, and environmental chemicals that you're exposed to as well, and that we're dependent on for our lives. But if we can limit the exposure to those environmental chemicals, then we're doing ourselves a world of good. Another obstacle or negative coping pattern would be overeating or eating the wrong foods, eating foods that taste wonderful but are terrible for you, or overeating foods. Next would be too much screen time, too much television, too much computer, too much phone, too much tablet, because then you become deficient, as I indicated earlier, in some of those very important social interactions that keep you healthy and well. Try to eliminate or minimize emotional outbursts to the best of your ability. So oftentimes that means talking to your partner, talking to your friend, talking to your boss, talking perhaps to someone who has a completely different opinion than you. But talking to them in a way that comes to a resolution without emotional outbursts, because those emotional outbursts cause stress, and we know that stress exacerbates almost every single chronic disease out there. And I mentioned earlier trying to mitigate deficiencies, not only nutrient deficiencies, but social deficiencies as well. Loneliness, a sense of loneliness or helplessness drastically impacts your health in very negative ways. So making sure that you stay engaged. Any kind of excessive behavior should be avoided. Absolutely. Everything in moderation, right? Let's see here. Let me get back to the screen and get some more questions here. Let me get some questions here. Can functional medicine help with COVID long haul? Absolutely. It is one of the best approaches to COVID long haul because it addresses some of the root causes that COVID set in motion. The microclotting, the changes in proteins floating through your system, the changes in hormones, the changes in inflammation. It's just an excited state of inflammation. Your immune system is dysregulated, it's imbalanced. And so functional medicine approaches COVID long haul through these root causes and not just the symptoms that reveal themselves as a result of the root causes. Next question is functional medicine approach. What is a functional medicine approach to mental health challenges and diagnoses? So, again, much of functional medicine is addressing health through those five pillars of health, making sure that diet and exercise is where it needs. I'm sorry, diet and nutrition is where it needs to be, making sure that there's therapeutic movement, balancing the hormones, detox mind body, getting the gut healthier, and supplementations of supplementation of various vitamins and botanical agents, and we can hone that in. We can look at the neurotransmitters, we can look at serotonin, dopamine, epinephrine, norepinephrine, and we can have a clearer understanding of which vitamins, of which herbs might be best for you. Let's see. Let me circle back over here for a moment. Get more of your questions. So many questions coming in. I love it. Okay, let's go here and then I'll go down from there. Which doctor is better to see that will check actually the whole body, the functional medicine doctor or the OD doctor? Good question. So MDs and DOs or ODs, they're trained the same. They're trained in conventional medicine. You actually have to have additional training in functional medicine. So I would say for you long COVID haulers out there, functional medicine doctor is the way to go. Most MDs and DOs do not have the additional training in functional medicine. Let's see. Next, I just read that long-term NAC or glutathione supplement can be harmful if you have some mercury in your system. Any thoughts? That's a good question. So low dose NAC shouldn't really cause a problem with mercury if you have mercury in your system. Glutathione, especially if it's IV glutathione, can. So for individuals that are either doing IV glutathione or high doses of NAC, I highly recommend that you get a heavy metal screening, either urine or saliva, not just for mercury, but an entire panel with aluminum and cadmium and arsenic and mercury and all the other fun ones. And it's harmful because of this reason. Um, NAC and glutathione can actually chelate. It can grab the mercury out of the cells that it's being held and bring it into the blood. And when mercury is in the blood, you feel terrible. And unless you're taking adequate steps to perform a true clinical detoxification, that mercury may be pulled out, may float around in the blood, and make you feel terrible for a few days, and then it'll just be deposited back where it was. So again, low dose NAC, not a problem, but if you're taking high dose NAC or IV glutathione, make sure to get those heavy metals checked first. Let's see, next question. COVID has caused me to have full blown dysautonomia, including POTS, gastroparesis, and small fiber neuropathy. My COVID antibodies are still over 9,000. Do you think this is causing all of my issues? I think it likely is. And I think that what my guess is that we're seeing an overexcited inflammation throughout the body, which is causing some microclotting, which is causing inflammation, which is causing some damage to the tiny little nerves, which is contributing to POTS and gastroparesis. So I do think that the COVID is contributing to that. And functional medicine is a wonderful approach because it can decrease inflammation, that microclotting, the irritation that the overexcitatory immune system is having. So I think functional medicine is an excellent approach. Let's see here. I have a lot of GI issues. I'm constantly dizzy and nauseous. I feel horrible pain. I get hot flashes and feeling I will pass out. I have so many issues since COVID. And I kind of addressed a similar question earlier. It's very common to have GI issues post COVID. It's very common to have headaches and dizziness, neurological issues after COVID, gastritis. Yeah. So again, I think functional medicine is a wonderful approach. It can address some of these underlying conditions, inflammation, microclotting, changes in protein, changes in hormones, which are common. So I think you're a great candidate as well. Let's see. Yeah, and another question, what's the difference between functional medicine doctor and a DO or OD? MDs and DOs or ODs, they're basically trained the same way. It requires additional training, hundreds of hours of additional training to be competent in functional medicine. Let's see here. I've got some time. I'll reply to a few more. Um, so I want to tackle this question because it's a good one. What what is functional medicine recommending for tinnitus? Tinnitus is ringing in the ears. So that's the cool thing about functional medicine. It doesn't address one symptom that you might be suffering from. Okay, that's terrible that you have tinnitus. Let's get to some underlying issues because you have tinnitus, maybe you have some other things going on as well. So let's really have a deep dive into your physiology, into your biochemistry, so that we can understand what are your mitochondria doing? How's your digestion doing? What's your immune system doing? Why is there so much inflammation just flooding your bloodstream? Why are there imbalances in hormones and neurotransmitters? All of these can occur after COVID, and there are other triggers as well. But since COVID, we've all learned a healthy lesson in a single entity. If it's an infection from a virus or an environmental toxin, it can cause a cascade of health issues. And so it's important to address the underlying root causes of these symptoms. Here's another great question I'd like to address, and it's very common as well. Let's Let's see. Since having COVID, my system is so sensitive to every. Oh, just scroll down. My system is so sensitive to every medication, and it makes my stomach issues even worse. Plus, the script the doctor called in was crazy expensive. Yeah, and I can't afford it. I haven't worked in a year. So that's not uncommon. And that's likely due to COVID making you more susceptible to environmental toxins, be they heavy metals, plastics, pesticides. And so an individual becomes just more sensitive to their overall environment, to the air, to the food, to the medication. I've heard that time and time again. You're just more sensitive to light, more sensitive to noise. um, it's very, very common, and it's a result of inflammation irritating the nervous system, causing a dysregulation, imbalance in hormones. And so, functional medicine is an excellent approach to that. Let's see. Here's one. Do you think that? Oh goodness, they keep coming in. Um, where did it go? Do you think that COVID is a biotoxin illness? I do think that that is a component of COVID. There's little doubt that not only the initial infection of COVID causes a cascade uh, of events that affect your immune system, that affect the inflammatory markers in your blood, but it leaves behind remnants, and your immune system remembers those remnants, and maybe it starts to cross react against other cells and tissues in your body. So I do think that there is a component to that for sure. I just had someone walk in. I'm sorry for the second interruption. We've only got about 10 minutes left, so I'll try to tackle some more questions. Give me just a minute to address this, and I'll be right back. All right, I'm back. For those of you late, my name is Dr. Ryan Shelton. I'm uh, I am presenting for the first time for mygotodoc.com on functional medicine, and this is my first week doing this. I promise we're going to be doing this each and every week. I'm so excited that you all are so excited. There have been so many questions that have come in, which means there is a big need for functional medicine for you all. And I encourage you to visit the website at mygoto.com and set up a consultation, set up an appointment so that we can get into individualized care for you. We can look at you comprehensively. We can treat you as a whole person, and we can engage you in your own health. Each and every week, we'll be presenting on a slightly different topic. This one was meant to be generalized, just an overall explanation of what functional medicine is. And I'm happy to repeat this general topic next week because we've been inundated with questions. But I can move on to a new topic next week. If you have a specific topic that you'd like me to cover next week, let me know and we can put it in queue. Let's see. I'm gonna get to just a couple more questions here, and then I'm gonna end in, let's see. I'm gonna end in 8 minutes. I will end in 8 minutes because I have to pick up my boys from school, and if Daddy's not there, there's a problem. Let's see. Next question: how do you slow down uh, adrenaline, the adrenal glands, by natural means supplements? Symptoms of constant adrenaline surging, and we've seen that the COVID seems to dysregulate and imbalance a variety of hormones, the sex hormones like estrogen, progesterone, testosterone, but it really seems to target the adrenal glands, and the adrenal glands are responsible for producing cortisol, epinephrine, norepinephrine, and not only can it change the total level of those adrenal hormones produced throughout the day, but it can change the circadian rhythm that should be there. And instead of high levels at, say, 6 and 7 a.m., and then gradually decreasing throughout the day and reaching a nadir or a low point around 9, 10, 11 p.m., and then gradually increasing throughout the night, COVID changes things. Perhaps that rhythm is completely opposite of what it should be. Perhaps your surge is nighttime and not morning time. Perhaps it's spikes and valleys throughout the day, and we've seen this time and time again. The best way is just to test and see where those levels are throughout the day. It takes 4 tests a day, and generally it's a home kit, so you can take it at home and get it sent into the lab, and we can evaluate that. But it's very common to have changes in adrenal hormones, and there are a variety of herbs and nutrients that can help to hopefully correct that circadian rhythm, and making sure that you're getting the correct total amount, but making sure that the rhythm is as it should be. Let's see. That So here's one. This one's pretty simple. Some of the more complex questions that are more specific to one individual, I can't necessarily tackle today. I would encourage you to set an appointment. What lab testing do you recommend for? Oh, there. Where'd you go? What lab testing do you recommend for heavy metal toxicity from vaccines and environment? Um, so the lab testing itself, I recommend dual. So there are basically 4 ways to test for heavy metals. One is the hair, one is saliva, one is blood, one is urine. I'm not the biggest fan of hair. I think it can. I think there are a lot of false positives and negatives on hair, just because the hair is exposed to the external world. Blood samples for heavy metal testing, those are for more acute exposure. So, walking on treated lumber that is coated in arsenic, or handling treated lumber that's coated in arsenic, you can test your blood. Yeah, you can see arsenic in your blood. Breaking a mercury thermometer, breathing it in, playing with the mercury, yeah, you can test it in the blood. If you have certain vocations or careers which involve chronic exposure, daily exposure, yes, you can test it in the blood. For non-acute exposure of heavy metals, I tend to rely on a dual test that involves both saliva and urine. It gives a pretty accurate um, result on chronic long-term exposure. And I run panels. I rarely run for just arsenic or just mercury. I run a panel. I think it includes uh, 16 or 17 different heavy metals. Let's see here. Last question. I'm going to tackle this last question, and again, I encourage you to come back next week. I might just repeat this general topic of functional medicine because the questions keep pouring in, and then the week after, I'll get more specific. And please continue the questions or the comments. You learn from each other. You learn from me. So we're all in this together, right? We need to learn. Um, not just from science, but from each other too. Um, let's tackle this one. I had an episode where my left foot and left hand turned purple, and something attacked my heart. And I had a seizure, but I believe it was like a small stroke. They couldn't find anything in the hospital. My heart rate went up to 180 just by setting, even if I have a heart monitor. Just going up and down the stairs, my heart raced, and I have lost over 40 pounds since have you seen any patients with similar issues? Absolutely. Dozens and dozens of patients where it seems to be the microclotting, the excited inflammatory response, the excited immune response, specifically affecting the nerves that are supplying the heart and that are supplying blood vessels throughout the body, that you feel like your heart is affected. You feel changes in heart rhythm. You might have angina or heaviness or chest pain. Blood pressure can be affected. It tends to go up. I have seen a few cases where suddenly after COVID, they have hypotension, similar to, say, POTS, which I addressed a little bit earlier. But more times than not, the blood pressure goes up. And not only does it go up, it can fluctuate quite a bit. It can go up pretty dramatically by 40, 60 points. And then if you do any kind of physical exertion, and then once you sit down in a chair for 10 minutes, it might drop again by 40 or 60 points. So I've certainly seen that happen. Functional medicine can be important. When when cardiovascular issues come up, certainly see a specialist. Heart monitors recommended to make sure that you stay safe and well. Having a home blood pressure cuff is important so that you can get readings throughout the day. But yes, cardiovascular effects of long COVID, very common, and functional medicine can be quite effective for that. So I've ran out of time for today. Thank you all for joining me. Again, my name is Dr. Ryan Shelton. I am with mygotodoc.com, functional medicine doctor for 20 years, treating chronic illness of all kinds. And we're seeing more and more chronic illness in the last decade, and certainly over the last couple of years since COVID reared its ugly head. And getting to some of these root causes that are exacerbated and changed from infection and inflammation and trauma is very important, and functional medicine can help you achieve those goals. So thank you all for joining me. I hope to see each and every one of you next week. And if you have any questions, go to the website, leave us more messages and comments, and we'll see you next week. Have a great week.